Hello, dear doctors. Hope I am audible.
Yes.
Yes.
Okay, thank you. A very good evening to one and all present over here. So it's time to start the session. So I extend my welcome to the President, IHK, Dr. Raju Karim, to take over the meeting.
Thank you, Dr. Mini. Just hold on 1 minute, please. Good evening, doctors. Hope it's audible now. Dr. Mini, please.
Yes.
Yes, doctor.
Yeah, sorry for the glitches. Okay. So the inaugural functions of IHK's webinar. In remembrance to our late Dr.PRAFULL Vijayakar sir, on his birthday, August 4th, is called to be in order. I first of all call Dr. Mini Sham, IHK's Manager of IHK, to deliver IHK credit.
Okay. We, the homeopathic physicians, believe in Almighty and His great creations, the nature and its mighty laws, faithfully follow the teachings of our master, Dr. Samuel Hahnemann, the founder of the healing art of homeopathy, hitherto shown its natural superiority over any other systems of therapeutics, is scientific, simple, safe, and effective to everyone. Stand dedicated with a mission to serve the humanity by restoring the sick to health in accordance with the nature's vital principle of cure, similia similibus curenta.
Thank you, Dr. Mini. I next call upon Dr. Kushrani Varghese, General Secretary of IHK, to welcome the gathering.
Thank you, Doctor. Good evening, all. Most respected Chairman of the meeting, Chief Guest of the day, Faculty of the day, distinguished guests, participants, my dear friends of IHK and Predictive School, ladies and gentlemen, I am pleased to welcome you all to the webinar on easy approach to difficult cases. It's indeed a great pleasure and privilege for IHK to host such a wonderful webinar on the birthday of late great Dr.PRAFULL Vijayakar sir. I proudly remember Vijayakar sir's maiden seminar happened in Kerala back in the year 2000, organized by IHK at Avenue Center, Kochi. I don't want to steal your valuable time as you all are eagerly waiting for the enriching session by Dr. AMBRISH Vijayakar. Let me officially welcome the Honorable Chairman of this meeting, the President of IHK, Dr. Raju Karim, to this auspicious event. It is indeed a great pleasure to welcome the Chief Guest of the day, who does not require much an introduction as he is well recognized figure in our fraternity, known for his wonderful administration and high achievements in the Department of Ayush. It is none other than Dr. Janardhan Nair, the first president of Medical Assessment and Rating Board for Homeopathy under the National Commission for Homeopathy. Apart from this, he served as the Assistant Director of CCR, Central Research Institute for Homeopathy, Kotte. And his contributions in the field of research is quite appreciated by all. Sir, it's our happiness and privilege to welcome you to inaugurate this webinar session. I really feel honored to welcome our faculty of the day, Dr. AMBRISH Vijayakar, for taking a keen part in this important program. Sir, hearty welcome to God's Own Country, Kerala, and Doctors Own Organization, IHK. I'm sure that you all will feel enriched with knowledge after completion of this event. Now let me welcome our State Treasurer, Dr. Babu K. Nabar, to the inaugural ceremony of this webinar. I would also like to welcome the teaching faculty chairman and keynote speaker of the day, Dr. Anita Anil, to this webinar. I would like to express my heartfelt gratitude to our Academy Cell Chairman, Dr. SHOYSON, who sincerely committed to make this webinar happen. Let me welcome Dr. SHOYSON, who is going to deliver Dr.PRAFULL Vijayakar Remembrance. Let me welcome Dr. Ashwin Panikar, our South Zone Vice President, who will be introducing the faculty of the day. I would also like to welcome Dr. Rajesh Aras, the State Scientific Committee Chairman, who is going to deliver the vote of thanks. I am more than grateful to welcome all the SEC, SC members, current and past leaders of IHK, all the participants, members of IHK, members of Predictive Homeopathy to this webinar. I wish you all a very successful webinar and hope that you will have a great time ahead. Thank you. Jai IHK, Jai Homeopathy.
Thank you, Dr. Kushrani Varghese. She is our first Lady General Secretary of IHK. Thank you, ma'am. Respected Chief Guest, Dr. Janardhan Nair, President, Medical Assessment and Rating Board for Homeopathy, General Secretary, Dr. Kushrani Varghese, State Treasurer, Dr. Babu K. Nabar, our dear faculty, Dr. AMBRISH Vijayakar, Dr. Ashwin, Vice President, South Zone of IHK, Dr. Anita Anil, Teaching Faculty Chairperson, Dr. Mini Shyam, Managing Editor, IHK News, Dr. Rajesh R.S., Scientific Committee Chairman, Dr. Muhammad Aslam, PRO, Dr. SHOYSON, IHK Academy Chairman, IHK's SEC members, SC members, predictive team, other IHK members, doctors from different parts of India, PG scholars, interns, students from different colleges. Good evening, all. I'm really happy to see the participation here because in YouTube also it's almost coming up. It's a high time here in Kerala because monsoon and downpouring is so much high, and a lot of chaos is there here and there. But still, when we keep a good seminar, people are there. First of all, thank you all for joining this function. IHK has been formed in 1987, so it's since 35 years. IHK has been there for all the important milestones in Kerala. Let me share that IHK is the largest voluntary organization with the professional organization of homeopaths, comprising all categories of qualified homeopathy practitioners. We have created undoubtedly so much to the development of homeopathy in Kerala. IHK has been stupendously engaged in conducting regular CMEs, where the pure objective is improving the standard of homeopathic practice. We have an experienced faculty team who delivers their knowledge to the fellow homeopaths through our regular CMEs. Till now, we have conducted around 98 state scientific seminars and also various district and unit level seminars. IHK have around 75 units throughout Kerala, and our next 99th state seminar is on August 28th. We also conduct monthly unit level meetings and CMEs. By all this, we encourage and uplift new upcoming doctors or youngsters in the field of homeopathy. Another important thing what our association does is that we have an insurance scheme for the members, that is social security scheme, which gives a financial aid to our members and the family after the death of the member. And it is operating since 2011. And till now, we have almost supported 65 families. And by that, through this scheme, we have spent almost 1.2 crores. And presently, the families are being benefited 3 lakhs each. This scheme is constitutionally uh, insured by IHK. We also give a lot of coaching classes for the PSC and medical aspirants. The thing is that we not only give this academic or clinical practice sessions, we give other things like sports, arts, and family get-together, so that our association will come as a family to each and everyone. IHK have organized many statewide protests and demonstrations whenever it is needed. Very recently, we are fighting against the upcoming Kerala Public Health Bill, which is deliberately against the Ayush systems. We have given the complaints as a memorandum has been given as a complaint to 144 and 140 MLAs in the state. We're not going to stop by this. Thing is that just giving a memorandum is not enough. That bill, it consists lot of disparities or deliberated points which are against the Ayush system. So we will go to the public or we'll come down, and any type of protest will be there if our points are not being considered. Another thing is, a few days back we heard that Ayush system, Ayush doctors can practice allopathy. Being an homeopath, to my personal feeling, I'll say loudly that I don't want to be a mongrel section. You know what is mongrel section? Because we as a homeopaths, we are about to uphold the teachings of our master. We should be there to keep a homeopathy alive. So practicing homeopathy along with other system of medicine is not our cup of tea, and we should always oppose that. And our association have been done. It's 2 years back when the same issue has come up. We have raised a voice against this, and presently now, even if still it is coming up, we will be standing against it, because we need homeopathy and we need to safeguard the purity of homeopathy. Today, we are much honored to present this webinar for the homeopathic field, an easy approach to difficult cases, in the name of our ensign of homeopathy, Dr.PRAFULL Vijayakar. Vijayakar sir was not just a popular homeopath. He even made a significant contribution in the field of medicine. Dr. Ambrish is there to deliver the approach. PRAFULL Vijayakar sir is not just to be remembered on this birthday, but every day, in every clinic, and by every homeopath who follows his teachings and gives patients an ideal cure. In this 500 people gathering, there are few may not be our members, not IHK members. So I welcome you all to IHK's family, where IHK stands for the betterment of the system. I'm concluding my presidential address. Thank you so much, and wish you all a wonderful learning session. Thank you. I next call upon our chief guest for the inauguration, Dr. K.R. Janardhan Nair. Sir, please.
So good evening, all the beloved members of IHK and other guests. Am I audible?
Sir, can you make it a bit louder, please?
Sure. Hello. Is it audible now?
It's audible. Yes.
Okay. So good evening, all of you. Good evening, Dr. Raji Karim, Dr. AMBRISH, Dr. Minisham, Dr. Kuchurani, other distinguished guests of the meeting. Congratulations to Dr. Raji Karim for arranging such a wonderful meeting in this evening. That more than 500 participants are already in the forum. It's a let it be a great success for the homeopathic profession. So I am happy and thankful to you for inviting me for this gracious occasion of the birthday of our beloved Dr. Prafull Vijayakar sir. Sir, all of us knows that Dr. Vijayakar has made a certain uh, winning points in homeopathy. That homeopathy has been established since 225 years and is being flourished. But during his period, during the time of Dr. Vijayakar, it has become more classical, and the significance of the modern science, that's genetics, biochemistry, physiology, and all those sciences are taken into account, and it is being well studied along with homeopathy, and the relevance of homeopathy is given to the public as palatable than some way or other criticized as a myth or placebo or likewise. So he studied homeopathy in a very scientific manner, and the theory of suppression, theory of miasms, and theory of chronic diseases have been explained to the society through his practice. Practical explanation is given through his practice, and also he has given enormous lectures all over the country and abroad also, and he gave lectures and in the seminars and workshops, and thereby he propagated homeopathy to a major extent. And with this spirit, the predictive homeopathy he has developed, apart from the classical homeopathy. Classical homeopathy has been followed by most of the doctors, and he gave a special name, that predictive homeopathy, and people honored that name and took as of their own and worked according to that. And we know many people, many thousands of people have won their life due to this approach in homeopathy, and they have achieved higher levels of life due to this. And I must tell you one thing, that the homeopathy practice is like a very vulnerable glass, that if carefully taken, it is very beautiful. It can be carried on through the lifetime, and always success is left for us. Whereas certain people are not taken into consideration of the principles of homeopathy, and that is not being used scientifically, and that is not explained scientifically, and how it is being administered also they don't know, and they fail, though they are claimed to be of classical homeopaths. Classical homeopaths means they will be using homeopathy scientifically in the sense of identification of disease. In that way, we want the diagnosis, we want the investigations, we want the radiological diagnosis, everything is required. And apart from that, we want to identify the person. The person who is sick means he represents the disease in different ways. Some persons are identifying the disease through the color of the sputum, maybe the voice changes, maybe the constitutional changes, or the simple alteration in the habits or lifestyles. So the person should be able to identify the minimal changes of his lifestyle or his normal routines, and thereby he can identify where this person is diverting and what sort of symptoms he is expressing, and what can be the remedy for that. For this, that a skill of perception of the symptoms should be there. I must tell very clearly that if that skill is not there, he can never become a homeopath, and he can never succeed in his life. How can we perceive the person? His person means we are not diagnosing any cancerous condition or diabetes or any lifestyle disorders. We want to perceive what is he and how is he, how he presents, and what is the predisposing factors, how he was in the past. So that change has to be asserted, and the disease has to be studied well. And the person himself represent the symptomatology of a particular medicine that is already there with us in our mind, and we have already studied, and definitely we will be able to get into the law of similars and identification of the similar remedy. So this is the skill we want to use, apart from the skill for diagnosis, skill to identify the prognosis, and to work with allopathic medicine and all those things. Now there was a discussion that modern medicine is preferred by certain group of homeopathic doctors, specifically in Gujarat and Maharashtra. They were working for a short-term course also without the consent of National Commission for Homeopathy itself. Maharashtra University has given permission for a short-term 1 year abridged course for modern medicine, modern pharmacology. We have given our objection on that, and as you have told, we know the spirit of the people of Kerala and the pure homeopaths, that we will never allow to do cross practice and make a stepping stones to allopathy, this homeopathy. These people wants to practice allopathy, and they want to get a name as doctor through homeopathy. So we will not allow such practices, and we have given strong opposition on that. And other than that, the IMC, NMC itself, National Medical Commission itself, has issued memorandum, and issued memorandum that either Ayurvedic or allopathic doctors, homeopathic doctors will not be allowed to do practice in modern medicine. That already they have done. So anyway, that is the theory. Within this short span of periods, maybe 225 years, we have achieved, we have improved like an advanced system of medicine, and homeopathy has got its own root, and it is spread all over the country than any other countries. And now the name of homeopathy is approved by the common people, and it has been established by all over the world that it is the most important holistic system in the world. So we don't have contraindications, we don't have side effects. We are the holistic medicine, and we are identifying the symptoms of the patients only, and we are treating to improve the immunity of the patient, and in all ways we are helping the human being and helping the vital force to improve itself, and improve itself to repel against the the diseases infected to the human organism. So if the human organism is revitalized on the basis of the similar remedy, naturally our vital organism will be energized, and the disease will be repelled. That theory is practiced by most of the people, and that is being experienced also, and that has become the this established system of treatment all over the in our country. And I must tell you one thing, in Kerala it is very proud to tell that compared to all other parts of the country, the most genuine homeopathic practice is going on in Kerala only. And I can tell you, the homeopathic education in all over the colleges of Kerala is exemplary and better than all over other states. There are other universities, there are other good medical colleges in different states. Still the 6 medical colleges in our state has got its own significance, and we want to get trained in these hospitals. For example, I must tell you, in Trivandrum Homeopathic Medical College, Calicut Homeopathic Medical College, National Homeopathy Research in Mental Health Kottayam, in Trivandrum Vidyadharaja College, Ernakulam Padiyar Homeopathy Medical College and Kottayam Homeopathy Medical College, the number of patients attending the hospital is anyhow it is more than 300. Minimum number are telling, and in certain cases it will be 1000. In certain hospitals it is more than 1000. So this sort of number is creating envy to other people, and from that number is not the issue. We want to look into the fact that this 300 patients, if it is there on an average in one hospital, means 300 cases are to be studied well. So each cases are a dictionary of materia medica or dictionary for the students. So we want to study out of that, and our people should study well from these resources. And I am not going much because I understood many people are there to talk. In fact, I would like to tell that in homeopathy, in India, Dr. Vijayakar has made his name, and he was the best student of Hahnemann, and we want to take some lessons from his speeches, and I must tell to the young people that we have to study homeopathy in the systematic and scientific way as Dr. Vijayakar propagates. If it is being done properly, the homeopathy will be the highest system of medicine all over the country. And our IHK, I know I am from 1987 onwards, I am an active member of IHK, and due to some occupational reasons, I am little bit silent, but I am always active. I am always in the IHK only. So I would like to thank Dr. Raju Kareem and other office bearers of IHK for inviting me, and I wish all the success for this webinar organized. Thank you so much.
Thank you, sir. Thanks a lot. We are so proud of you, sir, because he's our IHK member too, and he's from Etmanur, Kottayam district. Thank you, sir. Thank you for your valuable time. I know we have to. I'm so thankful for the participants for the patients hearing. We have few more speakers is there, and we'll be concluding very soon. Thank you for patience hearing. I now invite Dr. Anita Anil, IHK Teaching Faculty Chairperson, for the keynote address. Ma'am, please.
Most respected Chairman of this meeting, Chief Guest of the Day, Faculty Dr. AMBRISH Vijayakar, distinguished guests, and my dear participants of the webinar, ladies and gentlemen. It is indeed a great privilege for me to deliver the keynote speech in such a wonderful gathering of galaxy of speakers, leaders, and experienced clinicians of India and abroad. Clinicians often encounter patients having complex clinical scenarios where diverse, dynamic, diagnostic, and therapeutic issues interact. Health scenario in India and Kerala has been changed a lot since COVID-19. It is high time to equip ourselves to face any medical challenges at any time. Kerala homeopaths are much more enthusiastic to treat and cure challenging cases. They call it as challenging cases instead of difficult cases. We all believe that there are no easy ways to treat difficult cases. I am sure that Dr. AMBRISH Vijayakar will break our conventional concepts as he is going to speak about easy approach to difficult cases. Let us thankfully remember the legend, great Dr. PRAFULL Vijayakar, on his birthday. Homeopathy, as he says, based on immutable laws of science and nature. Hence, with his positive attitude and forceful drive, he moves on confidently on his chosen mission, that is propagation of the right homeopathy. Let us show our gratitude to Dr. PRAFULL Vijayakar by conceiving easy approach to difficult cases by AMBRISH Vijayakar and serve the suffering humanity by applying it in our clinical practice. I wish all participants a wonderful webinar with the team Predictive. Thank you, one and all. Jai IHK, Jai Homeopathy.
Thank you, Dr. Narada, for the precise keynote address. Thank you so much. And I invite Dr. SHOYSON, IHK Academy Chairman, for the remembrance speech. Sir, please.
Thank you for the privilege. Most respected Chairman of the meeting, State President of IHK, Dr. Reju Karim, respected Chief Guest of the day, Dr. K. Janardhan Nair, distinguished faculty, Dr. AMBRISH Vijayakar, and all the other distinguished people who are present over here, respected SC members of IHK, my dear doctors and students who are listening me from all over the world. As you all know, today we are celebrating the 70th birthday of Dr.PRAFULL Vijayakar, the Lion of Homeopathy, who has proved that homeopathy can be practiced with mathematical certainty if the basics are followed. Well, when I deliver this remembrance speech today, my memories go back to the year 2001 when I met Sir for the first time. So that was a seminar in Kerala where Sir was brought to Kerala for the first time by IHK itself. So when I attended that seminar in 2001, that was in Kochi, that was a great eye-opener for me because during that time, I was practicing with all the mother tinctures, pattern medicines, and all the specifics. Of course, I had results, but I was not satisfied. The results were partial. There was no cure. The people started asking me, we are continuing the medicine for 1 year, 2 years, the disease is now not getting cured. So will it be cured? So that there was a conscious prick in my mind that I knew that what I am doing is not right. So I must change my style of practice. And I was searching for a person to teach me the right method to practice Hahnemannian homeopathy. So that was when I met Sir. I attended this seminar in Kochi and I was amazed at the results, at the wonderful results produced by Sir with the cases shown by Sir during that seminar was very much amazing. Brilliant results were shown for the so-called incurable cases. So I slowly started studying the method of predictive, initially from Sir's books. And then later on, I attended the Mahabaleshwar workshop. That was in 2006, February. It was a 7-day workshop. And this was the workshop where I got all the fundamental knowledge about predictive homeopathy. And I got so much confidence to practice predictive homeopathy. And I came back from that workshop. From the very next day, I removed all the tinctures, patterns, and biochemics from my clinic, and I started practicing only with single medicine and with only with potentized medicines from that day onwards. So today, after 21 years of meeting Sir, the level of confidence which I have and the level of results which I'm able to produce, I cannot explain you. So that much is the change which has occurred in me. So I can proudly say that whatever I have achieved in my practice is only because of Dr. Praful Vijayakar sir. Sir was not only a homeopathic teacher for me. Sir has taught me how to be a good human being, how to be compassionate with your patients, how to take care of your family. He was a total guru in all aspects. And now, for those students and young doctors who are not so familiar with Sir or with predictive homeopathy, I will just mention some of Sir's important contributions to homeopathy, which makes him stand apart from the other masters of homeopathy. The first and foremost thing is the explanation of Herring's law given by Sir. It was only Sir who explained Herring's law on the basis of embryology. We know Herring's law is a cure has to take place according to Herring's law. So what is Herring's law? Herring's law says the cure should take place from above downwards, from within outwards, from center to periphery, and from the reverse order of their appearance. But this is a layman's language. It is not the mistake of Herring because the embryology was not developed during the period of Herring. So Sir Herring could only describe only in this manner. But we cannot say this way of direction of cure to an allopathic counterpart because they will laugh at us. So Vijayakar sir came up with an apt explanation, a very scientific explanation of Herring's law that is on the basis of embryological development. So as per embryology, it is the brain and nervous system which comes first, and the last organ to develop is the skin. So Sir has classified a chart of 7 layers according to the importance of development. So if it give a medicine to a patient, and when the patient comes for the follow-up, it became very easy to assess whether the cure is proceeding on the right direction or the disease is going in the wrong direction. So that is the most important contribution of Sir in to homeopathy. And second thing, the explanation of miasms. When I studied the miasms in my college, frankly speaking, I did not understand exactly what was the difference between all these 3 miasms except a few. Whatever was there in Sora was there in psychosis, it was there in syphilis also. But when Sir explained that miasms on the basis of as defense mechanisms, Sir said Sora is the primary defense, psychosis is the secondary defense, and syphilis is the tertiary defense. Then it became so easy to understand miasms. When we see a symptom in a patient, we can easily say that this is Sora or this is psychosis or this is syphilis. Because the cure has to again come from the higher miasm to the lower miasm. So this is the second important thing about Sir. And then again the third thing, whatever with Dr. PRAFULL Vijayakar sir has put forward as the methodology of predictive homeopathy is purely as per organ of medicine and chronic disease, nothing from outside. So that is something which makes him stand well apart from the other masters. So whatever Sir says, if Sir comes up with a new theory, so he will first quote the aphorism. So in this particular aphorism, Hahnemann has said like this, so that is why the interpretation is like this. So nothing is outside. So purely as per organon and chronic disease. And then the development of acute chart. Usually for our beginners, especially the young doctors, it is very difficult to treat the acute cases, to make results in the acute cases. They are finding it very difficult. So if you follow the flow chart of acutes developed by Vijayakar sir, it becomes very easy. Of course, some doctors are finding it difficult, but you should know how to use the tool accurately. So if the usage is right, then you will get brilliant results. And also that mobile app developed on the basis of theory of acutes has been downloaded in 180 countries. That is a record which is still remaining in the field of homeopathy. It is the highest record. And again, it was only PRAFULL Vijayakar sir who has produced the most outstanding results in the so-called incurable cases. I don't think any other master has the credit of producing such wonderful, amazing results.
And what was more amazing was that these results can be easily copied by his disciples as well if we follow the methodology taught by Sir. And again, the importance of studying the mind of pathology and pathology of mind makes practice very easy. I don't know how many of you are familiar with that, but lately, Sir was more into this concept, the mind of pathology and the pathology of the mind. Sir says, if there is a pathology in a particular patient, there has to be a mental conflict which is connected with this pathology. Only that particular emotional conflict can produce this pathology, and so it becomes so easy. You can probe in that direction and you can ask this particular situation where the patient has gone through, and you can select an appropriate rubric, and the remedy selection becomes very accurate. So that was the method taught by Sir, especially during the SCPH and the CPH plus sessions, which we are practicing very successfully, being able to produce wonderful results. And the way Sir was teaching Materia Medica, I have never seen any other master teaching Materia Medica so wonderfully, so easy to remember. Sir has he has acquired from whatever he was teaching was acquired was taken from his practice, from his practical experience. So every remedy was explained with that experience from the clinical practice, and Sir has come up with the rule-in points and rule-out points of every remedy. So when we repertorize the case and we differentiate the remedies, the knowledge of Materia Medica is very important to differentiate the remedies. So with the way Sir has taught Materia Medica now, it is very easy for us to differentiate the drugs. And he has again explained the soric picture of a remedy, psychotic picture of a remedy, and syphilitic picture of the remedy. So, so in every case, if it is a syphilitic case, you have to focus only on the syphilitic aspect of that particular remedy. So this is in short only the important contributions of Sir. There are a lot of other things to explain about him. I have not mentioned about his awards, awards and recognitions. It will take so much time. I'm not going to all those things. Just to make a few mentions, Sir was the panel homeopathic physician to the President of India. And Sir is the only homeopathic physician from India to attend the stem cell conference in Bangkok. And Sir is the only homeopath who is recognized by the ECPD, which is a part of the United Nations, and lots and lots of recognitions. We can speak hours and hours about Sir. And when I conclude, I don't believe that Sir is no more with us. He is living in our hearts. He has just completed his mission, and now it is our duty to carry on this mission for the sake of humanity. And I'm sure he has not lived his life in vain. With this, I conclude this remembrance speech about Sir. Thank you very much. Over to the chairman.
Thank you, Dr. SHOYSON. It has been a bit hard for each and everyone to wait such a long time for Dr. AMBRISH. This is an remembrance program, so definitely we need to speak about Sir. It may take some time, and I'll be so thankful if you are a bit having much patience. Okay. Next, I call upon Dr. Ashwin, our South Zone Vice President, to introduce our faculty. Dr. Ashwin, please.
Thank you. Good evening to all. First of all, let me thank IHK and Dr. SHOYSON for giving me this opportunity to giving an introductory speech for our faculty, Dr. AMBRISH Vijayakar. And for me, it's quite a personal privilege and pleasure because it's Dr. PRAFULL Vijayakar who clearly opened my path into the vast world of homeopathic Materia Medica, Without his teaching, I could never have accomplished his deep understanding of homeopathy. Speaking about our faculty, Dr. Ambarish, he is a man whose vision is to cure minds and disease permanently and has pledged to carry the fight for homeopathy. Dr. Ambarish Vijayakar graduated from Vivad Homeopathic Medical College and attained his PG degree from Shirsagar Homeopathic Medical College. He started his professional practice in the year 2005. It has been practicing as a consultant homeopath at Vijayapur since the last 7 years. He is a visiting lecturer at SKH Homeopathic Medical College, Aurangabad, Maharashtra. He is a member of Alliance of Registered Homeopaths, United Kingdom. Dr. Ambarish Vijayakar has been doing research in the field of homeopathy and science for the last 7 years. His area of research are simplified approaches towards mental disorder, pediatric cases, and allergic and psoriatic cases. Dr. PRAFULL Vijayakar and Dr. Ambarish Vijayakar have been talking homeopathy to the mass by conducting the running regular camps and clinic assisted by his able and trained assistants. Owing to his sound knowledge and energetic approaches, he is often seen conducting workshops and seminars across the country and internationally from London, Dubai, Scotland, Germany, Switzerland, Brazil, and Mexico. Dr. Ambarish Vijayakar, in his career spanning over 15 years now, has helped many people succeed in their career. It is our privilege to have this man among us today. Thank you.
Thank you, Dr. Ashwin. I know it has been much hard for you to cut short the many things and you deliver your part. Anyway, thank you for the short and precise intro about the faculty. Now, may I call upon Dr. Rajesh RS, our scientific committee chairman, to deliver the vote of thanks. Doctor, please. Dr. Rajesh, please. Dr. Rajesh, please. Unmute and speak now, please. Hello, Dr. Rajesh. Are you able to hear? Hello. Okay, I think there is some technical problem. Okay, so so anyway, I will do one thing. I will just wind up the function. Okay, I am thanking each and everyone for the patience hearing, especially the productive team for giving an opportunity, and IHK organizer each and everyone, so that it is a special occasion for each and everyone. Okay, so giving a vote of thanks just like that, it's much difficult, but still, just in one way, I'm winding up and I'm giving each and everyone thank you so much for attending the function, and then handing over the webinar sessions to Dr. Ambarish and the Prodigy team. Thank you, sir. Please. Sir, please.
Chat box open. Oh, चालू किया मैंने. Okay, thank you very much. Am I audible, visible to everyone? Is it loud and clear? If yes,
Yes.
type yes. Thank you very much. So first of all, thank you very much IHK organization for arranging this wonderful event of in love and memories of Sir. Let me wish you all first a very happy, predictive homeopathy day. and we seek blessing from our Guru, our mentor, Dr.PRAFULL VIJAYAKAR, sir. Let me thank President Dr. Reju, Chief Guest Dr. Janardhan sir Nair, Dr. Anita, Dr. Varghese ma'am, Dr. Soyshan, Dr. Rajesh. Thank you for the official inauguration. It's really a privilege and honor for me to be here in front of you online. And as rightly said by Dr. Anita madam, that it's a sea of people, around more than 500 joined and then few on the YouTube. So, that speaks volumes for what, people have joined for and what people want. People are here for knowledge, and purely they want to know what was sir's methodology. I'm sure there are many newcomers, there are many old people who have joined, there are a lot of senior practitioners who have joined. So if you know about predictive and predictive methodology, and they're practicing it and getting wonderful results. At the same time, we have new crowd who have joined, and I think all credit to IHK as well, that such a huge platform for all the youngsters, and I congratulate for IHK team for doing such a great job of having very excellent schemes, insurance schemes, CMEs and workshop. I think that's all what is important for a student or doctors to really understand that these platforms are not very easy. They are built over a period of time, and that's the only reason and the purpose is to spread education. So I congratulate them and thank them for having me on board for this talk. So without wasting time, let me greet you all. Greetings from Predictive Homeopathy. I'm going to keep my session precise, short, and to the point. Whatever I'm going to share with you is pure knowledge of my father, my guru, my mentor, Dr. Praful Vijayakar sir and Dr. Hahnemann. I'm just a commentator here. For those who are new, I'll try to emphasize slightly on the basics and then hike up on what we are going to see in the cases. Also, so seeking blessings from our master or guru, Dr. Samuel Hahnemann, and the reason for all being here. Then thanking my father, missing him to the core on his 70th birthday. And I thank all the viewers who have joined on YouTube and on Zoom, and those predictive homeopathy followers who have celebrated his birthday, 70th birthday, to the core, and cherishing those wonderful moments and seeking his blessings. I'll always remember him and miss my father. So vision and mission, yes, we have loads of aphorism, but what my father always focused on, that he says, you need, as a homeopath, we need to understand aphorism number 9, because that's the goal of homeopath. And when we say goal, because what Hahnemann has mentioned, I'm not going to go into details of the aphorism, but when Hahnemann mentions that higher purpose of existence, why should I be homeopath, or why should I be practicing homeopath? Maximum or 90% of young homeopathic doctors, when they come into this field, they are goalless. They do not understand what is the goal. There has to be a vision, there has to be a focus, there has to be a mission, and then that goal is higher purpose of existence, and that will happen when your internal dynamics as well as the external dynamics are in harmony. And then and only then there will be that evolution which happens dynamically, and making sure that the physical health and the mental health is kept in its own place, and evolution of that individual starts. So without reading the aphorism number 9 and without understanding 9, we as a homeopath have no meaning in practicing homeopathy. So higher purpose of existence, maybe this is not the platform where I can go in detail and to discuss that, but then just to tell you that higher purpose is to evolve. And if you want to evolve, the only evolvement happens through knowledge and wisdom, which is given by Dr. Hahnemann and Dr. Vijayakar sir. And then he focused on mission of an homeopath, which is reversal of disease. That's the mission. Why I'm finding the right remedy. Once I have a goal in front of me that I want to practice homeopathy because that is something divinity, and I want to, make sure that I evolve every day. And second, that when I am practicing or trying to find out the right remedy, that's what we call as a dharma. If I am a homeopath, I am a doctor, what is there in my hand is to find the remedy. The result of that case is not in my hand. So finding that right remedy and then having a mission which will be only accomplished where we see the reversal of disease happening. And as mentioned in aphorism number 1, that the high and the only mission of a physician is to restore the sick to health. That's he's talking about the reversal of disease. And aphorism number 12, where Hahnemann has focused on concept of disease and the morbid phenomena and the derangement of internal dynamics, that every disease in a body which happens, and this is how Sir has explained it so well, that nothing happens without a cause. Any disease in the body which an individual suffers, it has to have a reasons, and there is a mathematics behind. And where Sir emphasized that mind-body axis has to be taken into account. Without mind and body taken into account, we as a homeopath are not treating holistically. Then we are only treating symptomatically. We are prescribing on only PQRS, or we are prescribing as a keynote. But then a homeopath, the mission of a homeopath is to evolve. Sir himself said that I was a multi-remedy practitioner, not a single dose practitioner. And we used to mix remedies. But then he evolved and evolved and evolved and evolved and understood. He metamorphosized into a better and better physician. And then he made sure that the actual miracles happen through single remedy and single dose. So these are the 3 main concepts on which Sir always practiced. This was his mission, this was his vision, and he believed that this has to be, has to get imbibed and ingrained in each and every homeopathic doctor. We have to have a goal, we have to have a mission, and what is that what we are going to treat, what has to be treated in the disease. And once you understand, along with the mind and body axis, I think complete homeopathy comes in that package. Going ahead, the aim of this webinar is simple. I'm going to show you Sir's cases as is his birthday and his miraculous cases, so that lot many seniors would have seen these cases, but to show again probably to the newcomers and to understand the thought process behind, because the same case may not come to us, but similar case coming to us. What was Sir's thought process? Predictive homeopathy is all about that thought process. It's not giving intelligence to people. It is about giving that intellectual ability to think in that manner. That thought process is very important. What was that thought process? How did Sir apply his methodology to reach the simillimum? And hence the aim will be homeopathy easy. Homeopathy is mathematics, and that is simple. If mathematics is easy, approach is easy. Easy approach will in applying predictive methodology and seeing results in difficult cases. So each and every one of us are in a different state of evolution. We all, I'm also a student. I'm in this field for last 18-19 years. I was fortunate. I got around 16 to 17 years of my practice with my father, day in and day out, in the vehicle, at home, discussing and talking homeopathy. So each and every one of us are in different platform or level. So if I'm here, Sir was here or even above. So we need to catch up somewhere, and every day we need to stand up and go step up and evolve ourselves to understand and take those knowledge where our masters and teachers have gone. So it's all about process. Homeopathy is all about process. We need to just focus on process. That's all in life as well. We do not, if those people think about results, what will happen, how it will happen, results are not in our hand. What is in our hand is the process. And if if we focus on the process well laid down by Hanuman and Sir, I'm sure things will get much easier and get wonderful results. So going quickly, that our methodology, Sir's methodology, as mentioned by Hanuman in the organon, our practice, predictive homeopathy practice, is very hardcore based on organon. And most importantly, what Sir has told us is, first and the foremost thing, we need to understand the Hering's law. And if we focus on Hering's law, we need to understand Hering's law. We have to understand embryology. And that is why he focused that how the disease, he said that do not take symptoms lying down. The disappearance of an asthma is cured. Where the asthma has gone, what the process of asthma has gone, or bronchial inflammation, or pneumonia, or arthritis, or migraines, just by prescribing. That is which was prevailing at that point in time, that people prescribed for a disease, and disease would disappear, and disappearance of symptoms was not cured. And he laid his foot down in conviction, saying that Hering's law has to be understood in terms of embryology. So he proposed a hypothesis along with his clinical cases, showing that how ectoderm, endoderm, mesoderm, neuroectoderm has a big role to play. So how a fetus is born. So he laid down a foundation saying that, the growth axis of any fetus is the first 3 months is the embryogenesis, and the next 6 months is the fetogenesis, where the physiology develops. So the embryo has to develop in first 3 to 4 months. And how the embryo develops is basically ectoderm, endoderm, mesoderm, and hence the disease has to travel in that particular manner, because body is here to live, body is here to defend. And when the body is here to live and defend, body will always sacrifice its least important organ or a system first, and which is the ectoderm. Then goes to the endoderm, then to the mesoderm, then to the connective tissue, etc., etc., etc. And this is where, we try to share in module 1, module 2 about the embryological journey, that how a particular disease disappearing and coming up in other system. That was his focus, and he was to the core following that. And when we reverse the disease, and when we reverse the process, we need to see that a disease has to come down to ectoderm. So how and why does it happen? Maybe in different modules we can discuss, but I'm just giving you an outline. What was the thought process? Then the miasm, based on pathology, application of pathology and cell defense, because that was the mindset of people that point in time, where they used to consider disease as a disease and not disease as a defense mechanism. And where he said that even Hanuman has mentioned in aphorism number 74 and 75, where he says that every individual bring itself into a revolution, or bring itself inside a revolution, to make sure that he gets adjusted to the attacking stimuli. So it can defend itself by inflammation, defend itself by protection, or defend itself by degeneration and destruction. So that was the second miasmatic, second point on which the entire foundation of predictive homeopathy works, is the miasms. And unless until we understand miasm, because miasm is 3 guna, sattva, rajas and tamas. These are prevailing the entire human life. And unless until we understand which miasm or which guna the individual is in, we are actually not treating him as a whole, because we are not understanding the genetic process below. And that is what he emphasized on. It's all so simple, he said, that we need to just monitor and we need to just reverse the miasm. Reversing of the miasm from more destructive to lesser destructive and least destructive. Then he said that finding of the simillimum, which he mentioned as, which was based on the genetics, because history taking was a pain. What to take in the history, how to take in the history, where he gives systematic approach, that how mind has to be probed, how physical body has to be probed. And as Hanuman has given in aphorism number 5, that when an element from has to be taken in acute exciting cause, when the physical history, the physical constitution, when the mental makeup has to be taken and the disease makeup has to be taken. Once we club all these three together, the simillimum or the constitution, the process of disease and the process of miasm which is prevailing in this individual, and then prescribe, we see a Herring's law or reversal happening in particular individual. And all this purely on the basis of organon of medicine and philosophy. This is Bible, this is Guru Granth Sahib for us, this is Quran for us, this is Gita for us. And that's where he stuck to his guns. He always said disease is something like a tip of the top of the iceberg, where we are not treating an individual symptoms anywhere. If bronchitis is there, give any inflammatory remedies, or give, for example, not only in homeopathy, but give certain allopathic inflammatory or anti-inflammatory bronchodilators. You're just treating the effect. But what about the cause? What about the process which is going below? And then disease will prevail and disease will shift. The defense mechanism will go towards construction, and then you see growth happening. And as again an induration tendency or growth tendency or proliferative tendency will start coming up. And that is what Hahnemann said, it's a psychotic process. And if you treat and just treat the tumor, excise the tumor, remove the tumor, the body goes towards a degeneration or destructive process. These are the processes of the body. Whether you believe or not, it has to be there. These are the pathological process at the genetic level and will be seen in each and every individual. But it's only that when you understand the phenomena behind, you understand the process behind, will be able to understand the disease in the right perspective. Whereby he proposed a hypothesis in the book of Assumptions of Miasms, where he mentioned that how disease will shift his gear, how inflammations, the rhinitis, sinusitis, conjunctivitis, gastritis, etc. treated can go towards accumulation and proliferation. And if this is not good enough, and then they go into certain autoimmune disorders, ulceration, destruction, motor neuron gangrenes, malignant conditions, or even HIV or AIDS. So it's a process. It's a process of the body, and every individual is defending. Where is he defending is the question. How is he defending, and what has to be reversed in that case is very, very important. And on basis of that, he's, as Hahnemann mentioned in aphorism number 5, those new students who have joined, kindly note it down and read it again and again, that he says that homeopathic physician never treats the primary symptoms. If I'm getting cold, I should not take just allium cepa or just local homeopathic remedy. No, that's not right, because we are not supposed to treat the primary symptoms of the chronic miasm, nor the secondary affection that results from the further development of local remedies. So if you take some medicine, this goes away, and then you start getting cough, and then you take for the cough. No, there is a law. There is a law which is mentioned by Dr. Hahnemann that no, these are not to be treated in this manner, neither by those external agents that act dynamically, nor yet by those that act mechanically. But a homeopathic physician cures in cases where the one and the other appears only on the great miasm on which they depend. Homeopath treats the miasm, and this is what Sir said again and again, that we need to understand the process behind the miasm, and then the primary symptoms automatically. So whereupon its primary and secondary symptoms disappear spontaneously. And where Sir said that how disease are classified in this world is where they are curable, not curable, but only controllable. They are not controllable and not curable also, and there are certain diseases which have no treatment. Why we've come to a state, why the world has come to such a state? Because they are running behind symptoms, they are running behind the body, they are running behind the disease. And that's exactly where Hahnemann said 205, don't run behind the primary symptom. That's where Sir said that do not treat the disease, treat the man in disease. And aphorism number 72, where, Hahnemann has also said that if you don't treat the disease, let's say if a particular process in the body is going on, a process of psychosis is going on, that means somewhere the blood pressure has been rising, or your lipids have been rising, cholesterol has been rising, then the process is continuous. Oh, then we just attribute saying that, oh, he must be eating something which is fatty or farinaceous, or which is not good for him, and he's not exercising. It does not happen. That's only a physical symptom. And if we allow this symptom to go on, the disease to which the man is liable, either rapid morbid process or abnormal deranged vital force. So whether it goes rapidly or the internal deranged vital force, any disease for that matter, I'm just giving you an example. Disease of such a character that with small, often imperceptible beginnings, dynamically derange the living organism, each in its own peculiar manner. Every individual will derange in its own peculiar manner and cause it gradually to deviate. So if gradually it's been treated, my cholesterol has been treated, my cholesterol is been suppressed, I'm taking certain tablets to treat the cholesterol, then gradually the cholesterol level will start getting control, or my uric acid level will start going up. It will gradually deviate from the healthy condition in such a way that the automatic life energy called vital force is to preserve the health only opposes them at the commencement, and during their progress imperfect, unsuitable, useless resistance, but it is unable to of itself to extinguish them. So vital force is unable to fight because body is going into wrong gears, body is going into further suppression, body is going to further damage itself or extinguish itself to extinguish them, but must helplessly suffer them to spread and itself to be ever more and more abnormal. It will go towards the extent that it will go towards more abnormal, and then we'll say, oh, we have not diagnosed the case correctly, or we did not act in time. But if we don't treat the diseases and don't treat the processes, they are bound to go into destruction and even more and more abnormally deranged until the length of organism is destroyed. See how beautifully is mentioned. And these are termed chronic disease. We'll go into manufacturing of disease. As sir used to always say, we have to strike when it is strike in the, when it is required. And these are called by infections with a chronic miasm. And then it's not that we as a homeopath, we are, the physical body and the soul, or the dynamic and dynamic, or material and immaterial. Both are important. It's not that just we believe that it is the immaterial which we are treating and which we are correcting the immaterial. No, body is equally important. And that is why aphorism number 229, where he mentions, you can read all these things. I don't want to go into details of that. But when in the ending phrase he says, when the bodily health is changed for the better, that tranquility and comfort again beam upon the mind. So it's not only healthy mind and healthy body, but it is also the healthy body and healthy mind. So body is also so very important. We need to give importance and understand the process behind. And third, where sir always focus that if a disease has happened, if even a reflection of a disease has happened inside the body, it just cannot be, it has to, external malady for that matter, it has to have a cause. Aphorism number 189, he followed to the core that very little reflection will suffice to convince that no external malady can arise, persist, see how, even grow or persist or even grow worse without some internal cause, without the cooperation of the whole organism, which must be concentrated to be in disease state, consequently in a disease state. So internal dynamics is in a disease state, and that is a reflection of disease in the external malady. So just to show you a short case, what was sir's approach in this case, a young girl. It's a very old case, maybe old followers who have followed Predictive must have seen this case in Mahabaleshwar workshop. But for those newcomers, just to give you a short resume of the case, it was a cyst in the spine and which was causing paraplegia to this young girl. It was diagnosed as arachnoid cyst at D2 level. And the cyst was operated again and again. The cyst first occurred in July 2003. It was operated. Then cyst reoccurred in June in 2004. And in August 2004, tingling and pain again started, which indicated that the cyst is compressing and again giving this kind of symptoms. So what is important? Are we going to treat the cyst, or we need to treat the process? Again, aphorism number 205, if we apply, we are not treating the primary symptoms which are coming. Cyst is a defense mechanism. Cyst body is producing to defend. It's a process by the body. And what is happening, modern medicine or existing mode of treatment, they are just trying to understand and get rid of the end product or end effect. But the whole process of psychosis, process of accumulation, proliferation still exists. Until unless we reverse that, the cyst will not get disappear. So she was a case of 9 years, Rajeshri, and she had cyst in the spinal cord, which was recurrent. So how it started basically was, she started with fever. So SORA is what sir used to always say, that Hanuman said, no one can be free of SORA, and soric defense. First signs, first has to be inflammation somewhere, a generalized inflammation or a localized inflammation. And this happens recurrently. The SORA or the inflammation gets into secondary gear, which is psychosis. And then she had persistent 4 or 5 days of fever. Then pain in the chest would not go forward or backward, and she was put on allopathic mode. Huh? Am my video not visible to you all? Visible है? कुछ कर रहे थे? Yes, thank you very much. Thank you. So SORA began somewhere, and this is what was the thought process, how sir approached this case. And then I think those on YouTube probably will not get my video. There's some technical issue, but those on Zoom, I think I'm visible on. Not visible. Okay, anyways, you can hear my voice. That's okay. Okay, anyways, my voice visible to you all? I mean, audible to you all? So
Yes.
Yeah, voice and my slide.
Yes.
Yeah, thank you. So yes, so the second episode happened somewhere in June. Had a fall and pain in the lumbar region. Yes, thank you, appreciate it. Thank you. So she was going from bad to worse. Inflammation. So first is the inflammation which comes. The cyst, arachnoid cyst, cannot straight away come. There has to be a precursor. There has to be an inflammation. So the cartilage, that's what sir says, from ectoderm it has to go to endoderm, and from endoderm it has to go to mesoderm. So there has to be some inflammation in the ectoderm or endoderm primarily, which goes on to the mesoderm, also mesoderm cartilage. So mesoderm cartilage or the connective tissue, right? So that is the primary inflammation which happens. And this inflammation, if all depends upon the genetic lineage of that individual. So if the genetic makeup is predominantly sauropsychotic or soric, then that inflammation will not go into construction or not go into accumulation and cyst formation so easy. But if that individual has a psychotic trait or predominant psychotic miasm, then this inflammation, gear of inflammation shifts very quickly. You must have seen those small children who are having some runny nose or cold and coryza. So if they're having running nose continuously, they might have runny nose, watery discharge, fair enough. But then certain children who have runny nose for some time and they have stuffed nose or blocked nose, that is because they go into psychosis very quickly. They have psychotic tendency. Each and every one of us defend by a certain process. I have inherited certain genes from my mother and certain father. My body will defend in that particular manner. Similarly, when a disease strikes, first inflammation has to happen somewhere in ectoderm, endoderm or mesoderm, and then recurrent inflammations happening there, psychotic process at the genetic level, then slowly and gradually the whole process shifts. It shifts to accumulation, it shifts to proliferation, and it can give rise to a cystic tendency. So this is how it went inside. It went inside from Sora. It was threatening to go into psychosis, and it was getting worse for her. She was having difficulty in walking, pain while abducting. After some, maybe normal after some time, but fever for all the day, and she started even falling. And now she had pain in the legs, pain and tingling, which was okay with massage, etc. Again, a word of caution: massage, acupressure, etc. are only temporary relief. You're treating the effect. We are just treating the symptoms which are there, but that's not the disease. It's only, the disease will go into temporary amelioration. We need to understand the process behind. And the more we do massage, the more we do acupressure, acupuncture, etc., we are threatening the body to go from SORA to psychosis or psychosis to syphilis in easier manner. How the symptoms started? When the symptoms started, that she was very attached to the grandmother, and very so much attached that the grandmother passed away somewhere in April, and then she started getting fever on the same day. See how a constitution gets sensitized. Yeah, thank you, Dr. Vijayalakshmi. See how a constitution gets sensitized, and that is very important for us to understand. As Sir mentioned, Hanuman mentioned, that we need to understand what trauma has started, because from even SORA to psychosis, trauma has to be there. From psychosis to syphilis, trauma has to be there. So what was that trauma which lingered or stayed, and which caused that inflammation to go into a psychotic growth or a psychosyphilitic growth? So this was a sensitive child which got affected by grandmothers there, because yes, if all children are sensitive, all children are attached, they get affected. But affected to what sense? What was the reaction? And that reaction becomes very important. Was it anger? Was it grief? Was it fright? Was it shock? What was that reaction which caused a particular change of dynamics inside the patient and created the symptoms? And she still remembers, and she still missed. So this was the point which Sir has highlighted, that this was the symptoms where it has started. So if the patient had come to Sir in the earlier phase when this started, then the ailment from would have helped Sir to enter the case. But then we want a constitution which is sensitive to her grandmother's death, who is sensitized by it, who is affected by it. So what was the mental disposition? For example, number 211, 212, 211, 212, 213, 214, even 221, 222, 223 is all about dispositions. How individual, or what the focus a homeopath should have on the mind and the disposition, mind and the mentals. So if we are treating individual, we want to understand him. And when you're understanding him, first is the mental aspect, then is the physical aspect, then is the disease aspect. So all these three covers, along with its miasm and disposition, then we are nearing the prescription and or the right minimum. So in short, sir tried to understand her, what was her disposition. So her disposition was, patient likes to talk to everybody freely. She was caught in class talking. She's not shy to talk. But let me give you a brief before we go into the mentors that sir had prescribed her silica earlier. Sir had prescribed silica earlier. She improved slightly. There was some change which started happening, but then that amelioration was followed by severe aggravation, and she started getting too much swelling inside, the body. Then the sir had to change the prescription. She does not get angry at even all. If a parent scolds, she does not get affected. She's composed, she's cool, she does not get affected by if somebody is shouting. She will accept her mistake and she'll keep quiet. So this is how reaction has been collected. We are collecting the information about her disposition, her mental disposition. When she wants anything, she will ask for it properly at a specific time, and when will get it from her parent. So she is very sharp and she is very smart. She is very understanding. She never keeps nagging for anything. She studies on her own. She is very fastidious in keeping things all in place, and she is very affectionate and emotional, and she is very attached. So what an attribute to say an affection and emotional is when somebody offers the food, or especially small children, before they having the food, they will go and give to the crows or give it to the pets, or give it to the cows. That is that emotions, that love they want to transfer. Or for that matter, even home people who are there, they will offer the food to them. You eat first and then I will eat. So for her age, she was very affectionate, very emotional. She was fastidious. She was, she was a cool kind of responsible girl, and she was to study on her own. Even if it's too late at night, she will finish her homework and then sleep. So she was a conscientious student. She was a diligent student. She loved drawing. She loved painting. She was an artist. She loved small toys. She loved dancing. She had fear of darkness as well. Fear of dogs, but at the same time she has her own will. There is some stubbornness. So something like a Silesia, Silesia is yielding yet obstinate. So here also she was yielding but obstinate. And during illness, she could tolerate everything. She had no irritability. Parents say she has loads of tolerance. So initially she was kind of person, slightest physical problem, she would get anxious. She had a lot of anxiety, but then that was reducing. As the individual goes to psoriasis psychosis, this anxiety also reduces. This semester exam could not appear. She has now started to prepare for the next. She said, okay, no problem, I'll prepare for the next exam. She cannot walk. She does not feel bad about it. Okay, that's okay if I don't. So reaction is very important. How she reacts to the disease. What is her reaction and emotions to the disease. And in aphorism number 84, where Hanuman has mentioned that how he has behaved, what they have noticed in him. The physician sees, hears, and remarks by his other other senses what there is of an altered or unusual character. So what is an unusual character and what is altered character? Because some children are too mature for their age. If she's just 9 and 10, then the maturity or that responsibility or that contentment is too much for their age, and that's unusual in character, because that's the age where a child is playful, a child is like a child. And hence we need to understand during history taking which are those unusual characters and altered characters which we are looking at. And aphorism number 85, then as you go deeper, because detailed information of each part is also very important, because this is where Sir's recent approach went, that he went to the deepest level. First part is to understand the disposition, to understand the information about the disposition and individual. But the second part or the second aspect is from the detailed disease disposition, disease processes or pathology, we can go reverse back in understanding the predisposition and the process or the cause of a particular disease. And hence, it's not only the PQRS, it is not only the unusual part, but also each detailed information on each and every part. Where is the symptom coming? What is the symptom? So when we take the location, sensation, modality, yes, the location, sensation and the part is very, very important, because first symptom which the body gives is an indication for us that what is the mental thought process behind. So it's not only just the PQRS or usually disposition, but also at the physical level, where and how and which part the body expresses its symptoms. So what did sir do? What sir just kept certain disposition in front of her, front of him. So when sir used to approach sir cases, this was the old case, mind you, not on in the newest approach. It was different. Kindly stop scribbling on the screen, please. Kindly stop scribbling on the screen, please. Thank you very much. So what is important is, where first, what is the disposition was looking at, what kind of remedy. So he's to write in one page that I want a remedy which is a conscientious remedy, which is a sensitive remedy, anxious remedy, compassionate remedy, mature and responsible remedy. And why and how it started, what had affected her, what was that trauma which affected her. So what sir used to say is, do not consider ailment from when it's the disease has fully bloomed, but it is very important that when you catch hold of the disposition, then as a retrospective, whether the remedy covers or not, because it's about sensitivity and reaction. So what was the sensitivity of the constitution and what is the reaction of the constitution? And if that element forms covers even the mental disposition and the physical disposition, then it confirms our prescription still better. So as a resultant, once we have taken the basic disposition rubrics, once we cover that and then retrospectively understand what was that trauma, and we want a remedy which was very similar to silica, because silica had shown some changes, but it was only amelioration followed by aggravation. So these were the rubrics which sir had taken. Responsibility strong, sympathetic, compassionate, ailments from shock. So as I said, he had taken ailments from shock, because that was a shock for that particular girl, that point in time, that I've lost my grandmother, and she went on crying and crying and crying. So just to see whether the remedy covers, but sure needed a responsible remedy and a sympathetic, compassionate remedy, which is an artist which loves drawing, which is responsible, which is contented, etc. Pulsatilla is more of a weeping disposition. Pulsatilla is more of a, yes, the remedy was carcinosin. Yes, Dr. Suvarna, Dr. Pavitra, the remedy was carcinosin. She was hot, she was thirsty, and how sir used to always say that similar remedies, this carcinosin and silicea look the same. Carcinosin and silicea run parallel. And even lycopodium, they run parallel, but there would be some difference, though minor difference. And when we prescribe those and we certain times miss those minor difference, we get partial results or amelioration followed by aggravation. So responsible, conscientious, so question is for getting similar. Why did not single symptom like pain, etc. taken? Again, if you've taken enter through taking the symptom like pain, then we are probably entering through the disease manifestation. We could take Dr. Gupta, we could take it later when we have confirmed the prescription or taken the mental disposition and then cover it and see whether the particular also covers. So in such cases, it's the disposition primarily, and then we go and see whether the particular covers. Is it clear, Dr. Gupta? And then a remedy which was similar to silica, carcinosin 200 single dose, and I'll show you the video of that girl. Yes, we can think about Ignatia, but Ignatia did not come in the repatriation. Ignatia and Silesia are also the same. But Ignatia is affected. Ignatia is is an esteem remedy. Ignatia is a remedy which is affected by position. Carcinosin is also an esteem remedy, but carcinosin is a remedy which wants love and which is sympathetic at the same time esteem. But Ignatia is more bothered about position. Carcinosin is not bothered about position. Ignatia, the carcinosin is more towards contentment. Ignatia is not towards contentment. It's towards higher esteem. So sir wanted a remedy which was closer to silica. So remedy which is very closer to silica is more to do with carcinosin, and I'll show you the result. She was brought to sir, who was lifted and brought. And taken also out. Then we'll go to the second video.
लांब तिकडे जातो. पकडूनच चालायला लागते.
पाय पुढे जाऊन द्या समजा पुढे घेते बाहेर आधार घेऊन सुद्धा
सकाळी सकाळी पाय
सकाळचा मी तिला उचलूनच आणतो.
म्हणजे पुढे जायचं पाय मागचा पुढे जातच नाही.
स्वतः येत नाही आणि आपण उचलून टाकण्याचा प्रयत्न केला तरी
पाय हलवताच येत नाही सकाळी. मग किती वाजल्यानंतर तुला होते तसं बरं वाटायला लागते? 12-12:30 नंतर बरं वाटते. उपाय पुढे हा बस. नाही चांगलंच आहे.
Third, I'll show you the fourth.
ठीक आहे, 1 महिना कशी बाहेर जाते ते बघतो ना, कारण त्यावेळेस पकडत
gait improved, walk improved, limp is there, but she is able to walk independently.
Tell me more about his nature.
And then
गुड झाला परत पाठी दाखव She was not able to walk. Huh? English येते? नाही. बरं पाठी जा पुढे जा.
Go in seventh one.
See, you know English?
Go on.
Huh? You can talk English, walk English. You can walk English? She got confused. Acha, show me.
See the speed, see the gait, how she improved.
Daja Selasi. Good. Excellent. कसं वाटते तुला आता?
And then the last one, this is the latest in 2008 where sir has taken that she's almost fine, she's grown.
Huh?
See, she's come to school.
काय काय करतो
See the
आता?
body language.
सायकलवरून शाळेत जाते
काय?
परत पण येते
Goes to school, she comes back on
कसं
her
एकंदरीत
own.
तिला आता?
चांगलं आहे
छान ना? किती वर्ष झाले आता आपलं औषध बंद
Now
करून?
let's stop medication now. She was not on medication.
म्हणजे तिला ताप आला होता
हां.
आणि तिची तब्येत एकदम जास्त होऊन गेली मग त्या दिवशी औषधी तुम्ही पाठवलेलं होतं
अच्छा अच्छा नाही पण ह्याचं औषध बंद केलं आपल्याला किती वर्ष झाली?
2 वर्ष
2 वर्ष ना?
म्हणजे चालू असताना तसं झालं मग
2 years, sir had stopped treatment for the
बघू
same.
चालू नका दाखव छानपैकी चालते ना? दाखव त्याच्याला जा अशी
And she's able to walk.
एकदम अरे वा छान छान
फक्त ते पावलामध्ये थोडा फरक वाटतोय पाहिजे
A wonderful result and one miracle of Sir and Hanuman. No repetition, single dose was there. Jai homeopathy, yes, that was a miracle of Sir. And somebody asked me about acute. Acute, yes, we don't give any remedy in between unless until the acute is quite, what you say, we're going to pseudosyphilis. If not, maintain on SL and the reversal happen. Again, this is to show and emphasize that how sir considered it's we need to treat an individual. And yes, the cyst completely disappeared. Of course, I don't have the reports here now, but cyst disappeared. 200 single dose. If cyst would have not disappeared, she would have not walked in this manner. That is where Hanuman says, footnote number 9, footnote number 8, where he says that those symptoms, it cannot be that a disease will remain inside. If the symptoms which were externally visible have recovered and she's walking in this manner, the symptoms would not remain inside. And it is insult to a common sense that how the cyst will or the disease will prevail inside. That was another magic of Sir and Hanuman. I hope you understand the thought process. And I'm just showing you those miracles of Sir and his thought process. Probably it will, help us in our practice. The small tips, small differentiations. Even if the patient takes allopathy for small problems, don't worry. If it is a physiology, then probably it may get disturbed. But if it's a pathology like this, I don't think any allopathic medicines or taking of antibiotics even disturbs the pathology. The reversals will still happen. So it's better to wait and watch. So we want to take a 5 minutes break. I think
Thank you,
Yes,
sir.
thermals will be important. Yes, if we get the thermals, important, Dr. Aishwarya. Yeah, it's important.
Thank you, sir. That's a great session going on. Anyway, let me have a trendy short break in between. And it's a great privilege for me to invite all the doctors present over here to the 99th State Scientific Seminar of IHK, which is to be realized on 28th of August 2022, Sparsham 5. So let's have a look on the in a glance over the whole thing. It is to be held at Malappuram. So kindly. Dr. Mohammad Aslam.
College Tamil Nadu, Chief Physician, the HMS Hospital Changanatri, who will enlighten the IHK Malappuram District Committee is organising this great event, which is hosted by the IHK Manjari and Kottakkal units. It is specifically planned to endow homeopathic doctors with incisive knowledge and innovative skills to reach the pinnacles of excellence in homeopathy. Team of faculty consists of Dr. Padmanabha Shenoy, D. Medical Director and Consultant Rheumatologist at Centre for Arthritis and Rheumatism Excellence Care at Cochin.
What is challenging is that because they don't have a uniform symptom, they go from pillar to post before the diagnosis is made. Because somebody feels tired or hemoglobin is low, they will go to a family physician and they will think it is because they are female, their menstruation is happening. They will take some iron tablet, wait for some time, it is not improving, the platelet counts are not improving. So they are investigated multiple times and they go to multiple doctors before a correct diagnosis is made. Things have grossly improved over last 10 to 15 years, I should say, because as you know, the diagnosis of, most of the time, diagnosis of lupus is made with the initial screening of a test called anti-nuclear antibody or ANA.
Dr. S.G. Biju, Assistant Professor, Department of Repertory, WMH Medical College, Tamil Nadu, Chief Physician, the HMS Hospital, Changanatri, who will enlighten the participants with brainstorming sessions, management of rheumatic disorders.
Prescribe podophyllum for arthritis. Have you tried slag for arthritis? Is there any permanent cure for rheumatoid arthritis and autoimmune arthritis? These are the questions in minds of every woman. There is only one answer, that is Sparsham 5, going to be held at Malappuram on 28th of August. Please come, let us share our valuable experience and treat and cure and offer and deliver permanent cure for autoimmune arthritis and other arthritis. Thank you.
We should feel elated by your presence and participation in this expedition to unrecognized realms of nature and its law of cure. So let's register for this grand Katogatha of homeopaths after pandemic and join as a part of this great seminar event. Book your seats as early as possible. For registration,
over to Dr. Mini.
Okay, so that was it about the seminar. Now one more a very short video about the SSS scheme, which already our president has mentioned during the inaugural session.
hello
So
there.
you can.
I have a few doubts about the social security scheme. Do you know what it is?
Hello, doctor.
Hello there. I have a few doubts about the social security scheme. Do you know what it is?
Hello, doctor. Good that you asked. SSS, or the Social Security Scheme, is a support fund for the family of IHK members in case of their death.
How can I know if I am eligible for SSS?
Anyone who have an active membership in the Institution of Homeopaths Kerala and no due in SSS are eligible for this.
Okay, so how much should I pay to join the IHK SSS?
You have to pay 200 rupees as an renewal fee and 200 as fraternity contribution if an SSS active member dies.
Oh, that's really a small amount. I doubt if this is a sustainable scheme.
Yes, it is. The Social Security Scheme was started back in 2011, and after 11 years, the total collected amount from a doctor till date is just below 9,500 rupees. And even with this smaller contribution, IHK has successfully managed to deliver 65 fraternity contributions so far, and that's about 1,18,50,000 rupees. And even more, the fraternity contribution earlier was 1,50,000 rupees, and then it was raised to 3 lakhs rupees. And they are planning to raise it to 5 lakh rupees in near future.
Do you mean to say that this small amount of 200 rupees will suffice for a return of 3 lakhs?
Of course. And that is the main attraction. You can help your fellow doctor's family in need by paying just 200 rupees. Think like this. If you go for a movie with your family, you may spend around 500 rupees, or for a dinner around 1,000 rupees. And your monthly Netflix plan is around 200 rupees. And here you can help your fellow doctors by just spending as low as 200 rupees. Isn't it beautiful?
Wow, that's really great what they are doing. But do I really need SSS? I have other insurance already.
As I have mentioned, comparing with the other insurance policies in the market, you are getting a really high return with a really, really small premium. If you are 25 years old now and you start to pay SSS, and suppose there will be 12 deaths per year, And then you have to pay 200 rupees for each death. And if you continue that till you become 80 years old, even then the amount you pay will be only around 1,32,000 rupees. And remember, this is only if there will be 12 deaths a year for the next 55 years.
That's really comprehensive. All right, I believe this is a great plan where I can help other doctors' family when in need, and also provide security to my own family when I can't. Like they say, gone but never forgotten.
You are absolutely right, doctor. Gone, but never forgotten.
You have cared for them. You have provided for them. But what if you can't? What if you are not there? Join IHK. Join Social Security Scheme.
Okay, so that was all about the social security scheme and the upcoming seminar of IHK. So those whoever is interested in joining for these things can contact us. Now I shall hand over the mic to Dr. Ambrish, sir. Sir, kindly you can continue your session now. Thank you, sir.
Hello.
Okay, am I audible, visible?
Yes.
Yes, we'll come to the questions later on. If you can allow me to complete few cases, we'll come to the question. I'll answer all the questions. Thank you. If you would like to have one more case of sir and his thought process behind, so we'll run through it quickly. Okay, so this was a case of young boy, and he was diagnosed with retinitis pigmentosa, left eye which was affected more, squinting of both the eyes more in the left. Every symptoms which the body is trying to throw has a meaning behind. It's just not that by chance that certain symptoms are coming. This is where and how the new and newest research of Sir was moving. That why body is going into a particular disease state, what is the disease diagnosis, but most importantly, which part is affected, is if it's the eye, which is the left one or the right one. If it's the right part, it has to be work, it has to be partner, it can be business, it can be a distant relative, etc. If it's the left side, because that's a sensitive side of a child, then it could be mother, it could be brother, it could be sisters, it could be home, it could be pet, etc. So this is how our history taking should start, and our point of focus and point of entering into a case should start, because at every step, every symptom, body is trying to give us a lead. If it's the squinting of the eye, it's more of a psychotic process. It's less of elastin, because the muscles of the eyes are unable to hold the focal lenses, whereby certain of the what is it, are unable to hold certain, the muscles are unable to hold because of certain psychotic process inside, and hence you could see certain squint happening. The reason for squint also is different. The reason for inward squint, or squint which are going outside, so all reasons could be different. If a child is getting hurt and getting shallowed feeling, being humiliated, or does not want to see certain thing happening in the family, or been scolded, then it could go into inward swing from the father's side or from the mother's side. If it is going towards outwards, then he's trying to not look at the focus but move his focus away, and he's trying to look away from home, is trying to look away from father, away from mother, etc. So every symptom, it's all to do with symptom, because all symptoms inside the body are reflecting nothing but the process inside, what is creating that morbid phenomena, or what is creating that phenomena which is creating the disturbances. So color vision defect is also, there is no clarity, there's no clearness in this individual. So only from in the latest technique, what we discuss in SCPH and SCPH plus is this kind of attack. We do not go into the depth of the case so much. Right from the disease diagnosis itself, we go reversely, and then we question the patient or the patient's parents and get the information. But then this was solved more from the earlier perspective, and more from the earlier part of disposition, taking the syphilitic rubrics into account. So history of mother, it was an early pregnancy. After marriage, she had vomiting till the 7th month. She had taken medication. There was conflict in the family, especially with her mother-in-law, and she was hurt, she was weeping. There was a constant and frequent journeys during the pregnancy. So it has to be some sora or sorosyphilitic manifestation, and then still going deeper. Then spontaneous delivery, labor pains only for a few minutes, and then she delivered. Birth weight was good, 3.5. Child cried after birth. This was a past history. How sir used to take earlier. All things stand still true, that whatever he has taught in the earlier method, that how a disease progress, and how a disease expresses itself starting from the pregnancy, and what was the mindset of the mother. Kindly stop scribbling please on the screen. So cold and cough, going from endoderm, going inwards towards affection, causing malaria, causing chicken pox, again causing malaria, and received injury to the left eye. So again, receiving injury also is mathematics. Some has to have problems with the mother, has to have problems with the sister or brother, etc., or home front. Everything is mathematics. Then all the vaccination history, hepatitis, typhoid vaccines, milestones were okay. You used to constantly look at bright objects, etc. No focus on seeing certain objects. Is craving for ice creams and chocolates and food, lemonades, etc. He was hot and thirsty, had good stamina, and preferred loose clothing. He was a very high active child, hyperactive child, never sat in one place. So that is the physical. So mental disposition, physically was hot and thirsty, and physically also he was a restless child. Mentally he was also a restless child, very sharp memory, very peculiar memory, and that too about timings, about railway timings. Mixes with people very easily. So these are the disposition what sir was trying to collect information of, how he's reacting, how he's responding. This is a natural, normal genetic trait. He was not very attached to parents, he could stay away from parents. So each and every child, his attachment towards parents, or attachment towards home, this is what he would probe, because in going into the history and detailed history, he would like people, coming to his house. He would enjoy people and the company. He cares for them, looked after them, and then speaks very fast and hurriedly. So fast, hurried remedy, restless remedy, constantly moving and jumping, not very peculiar in keeping things, So interested in electronic gadgets, so gizmo geek kinds, uh, puzzles, then manipulative fondling of genitals, handling of genitals, angry remedy. So disease was retinitis pigmentosa, so which is a very rare disorder where you actually see the sensitive layer of tissue, which is back of the eye, which makes the cells break down and go slowly into destruction, causing slow loss of vision, gradual loss of vision. So if you understand the pathology is psychosyphilis, psychosis going into syphilis, going into this destruction and pigmentation. So sir said we want a remedy which is psychosyphilitic in nature, and hence he said that aphorism number 5 is very important: physical and mental disposition, physical character, mental character, is sexual functions, his morals and intellectual character, everything, as aphorism number 5, as Hanuman has mentioned, we need to take into account along with the chronic miasm. Then we are completely taking the process, the mental disposition, the physical disposition, the general disposition, and then we'll be able to reverse the process. And also, most importantly, is the significant point in the whole history. So as we understand disposition, as we get nearer to the disposition is a strong general disposition for us to enter. A group of disposition is good, but as we go closer, as we go higher, as we go deeper, we should come to a point where we get certain significant point. So it could be a significant point, it could be a PQRS, it could be a striking symptom, that, and all this what Hanuman mentioned, he clubbed it into syphilitic symptoms. Syphilitic symptom, because mind and body denotes the same language. If body is defending by psychosyphilitic process at the genetic level, at the pathological level, then it is important for us to hunt for certain thought process which are psychosyphilitic in origin. So what was that psychosyphilitic process sir was trying to understand? So PQRS is 153 singular uncommon characteristic symptoms. So not attached to parents. So attachment also, when we probe in the history, we need to understand also, can the child stay alone? Can we stop the scribble, please? It's disturbing everybody. If you're not interested, kindly leave the room. It's not for you, but please do not disturb others. I don't want to take the names here. I know who is doing it. So please, please leave the room or delete it. It's not right. Sorry. So what is important is that attachment to that parents. How is the attachment? Does the child is clingy? Is the child want support? Is the child want protection, or the child even at young age can stay alone? So attachment is one factor. We need to probe different factors of attachment of a child, because whatever it takes for us to enter the case, whether it is the will, intellect, moral, speed, sensitivity, attachment. So it's very important to probe individual aspect, and this is what sir has given us a thought process. Sir has shown us the way that how to probe syphilitic symptoms. A patient is not going to tell us come, or a young child for that matter is not going to come and tell us that I'm indifferent to loved ones. It's the conversion of behavior to rubric is so very important. And as a physician, I think that's the challenge we all face. That's the challenge we all face. But then that is a certain thought process. It's a certain thought process which we are trying to, share with you. What was Sir's thought process? How would he read? What is that disposition? And that is that PQRS, because normally it's an attachment of the child. So that attachment could be to the parents, attachment could be to the grandparents, attachment could be to the house, to the toys, the areas, extra. But attachment as a child has to be there. That's the sora. Attachment is the sora. And if attachment is not there, the child is not no more attached to the parents. That means the child has moved from sora to syphilis, maybe from psychosis to syphilis for that matter. So indifference to loved one is the first rubric what sir took after conversion of this behavior. And then second rubric is he was fast and hurried. That's the genetic makeup of the constitution. That's how he would react, how he would speak. So one is the strong inherent genetic trait, fast, slow, hurried, is impatient, etc. And then moving towards syphilis. So catch hold of genetic strong trait, which is the disposition, right? And one is a strong trait which it's been reduced from the behavior or converted from the behavior, which is the PQRS, which is the high significant point in the whole history, and that is indifference to loved one. And when we combine these two, because mind and body is very important, mind body axis, I was trying to tell you that no disease can come, no disease can prevail if the order does not come from the mind. So mind is showing certain, rather body is showing certain destructive process, mind also has to have this destructive process. How Hahnemann has mentioned the affection of morbidly deranged spirit-like dynamics, the vital force which he mentions, morbidly deranged. It is deranged morbidly primarily, that animates our body in interior, and the totality of outwardly cognizable symptoms. That's the totality of outward. That means the symptoms which are coming, left-sided, squint. That was the earlier process. Can you please restart sharing screen so that the scribble will erase? Okay, let me try this, Dr. Amar. I'll try that. And so yeah, thank you. Now it's clear, right? So then affection. So that which gets deranged, the vital force which get deranged, and that which animates the body in the invisible interior, and the totality of outward recognizable symptoms produced by the organism representing the existing malady. So what was the existing malady? What is the disease process? One is the disease diagnosis and one is the disease process, and that constitute the whole, and they are one and the same. And hence further he says that the organism is indeed only a material instrument of life. So in particular, is it not visible? Is it visible now, Dr. Jayashri? Yeah, thank you. So the organism is indeed the material instrument. All what we stool sharir, this is the physical body, which is what we have, is only an expression, is only a material instrument. It's only reflecting, it's only showing the end product of the disease, and that's not the disease. But it is not conceivable without the animation imparted to it by the instinctively perceiving and regulating dynamic. This body is imparted by animation, by the vital force, and vital force is a precipitator. It precipitates or facilitates the body, but that is responsible for creating the external symptoms. Just as the vital force is not conceivable without the organism. So nobody can see or touch or feel the vital force, and it is not seen. So for that vital force to be seen, my physical body, again somebody is doing. My physical body is very important, and that will show that it will show that vital force exists, right? Just and the together constitute in unity. Although in thought our mind separates this unity into two distinct, which means that from the mind and body we are two distinct, it separates us, but for the conception of sake of easy comprehension, let's not go into detail of that, but go ahead and analyze what was Sir's analysis. Just how simple and how easy it was, how easy it is, the simple way, how a man looks, how a man talks, how a man behaves. If it's talking fast, is it talking slow? Is it talking, taking its time to speak? So that hasty or impatience which is being seen or which has to be observed. So one genetic strong representation has been taken, and one strong representation of miasmatic rubric which was taken. So indifference apathy to the syphilitic PQRS, call it hot and thirsty, hairs and nails grow very fast, and extremely physically restless, and the remedy which was fluoric acid. Yes, unanimously, yes, everybody coming to a conclusion, it was fluoric acid. So when the remedy comes out, it looks very easy, but the thought process behind to take the crux from the case is what was Sir focusing on. And the thought process that how to identify a fluoric acid, how to identify fluoric acid children. That not all children will come and say, my hair and nail grow very fast, or that for that matter, I have excessive stamina or have excessive sexual urge. But that element of understanding a fluoric acid child, that no attachment to parents, no attachment to home, no attachment to brothers and sisters is what is the core, what Sir used to always say. Absolutely right, Dr. Suvarna. So no attachment, so attachment can be found, or no attachment also have to be hunted in that particular manner to see whether he is a fluoric acid. Yes, hot palms also is one of the indications for fluoric acid. So I'll show you how beautifully he improved. I'll show you the Samu itself. So this he was trying to see the ball where the ball was. He was unable
लेफ्ट में
to
लेफ्ट
see where was the ball,
बेटा
and father was
यहाँ
trying to
लेफ्ट
tell him it's on the left side. Still trying to hunt where is the ball. Yes, that's right, Dr. Priya.
What color is this?
Dark blue.
Dark green. Very good. This color?
Dark blue.
This one?
Red.
Very good. And this one?
Orange. I remove my specs when studying, playing on computer, seeing TV, all that. Legal will purpose.
You remove the specs?
Yes.
You can see it clearly.
Yes, both. Yes, Dr.
Is it a fact?
Anyway, it was
He just
version to family as
He's
well.
not wearing only. અને નજીક जैसे भी नजदीक का पढ़ने है ऐसे तो he is ऐसे using this way ऐसा मतलब he always if he wears specs he looking from up or down but not throughout the specs.
Through the specs.
And finally he just removed and kept it aside.
Remove your specs and read that.
Remove the specs and read. सामने कैलेंडर पे पढ़ो.
Saraswat Bank.
And what is written below the Saraswat Bank?
This.
Saraswat Bank Saraswat Corporative Bank.
Look there.
Bank Limited Scheduled. Open bracket scheduled bank.
What do you mean by? Tell me better. What do you mean by better?
In my Bajuwala society, every day I go to play. So their construction is there, all iron rods and everything is there. Yet and very less light is there. Yet I can see over there.
Then that is because I think first video which you had given me on the phone, that showed that he could not even see the ball, red ball.
Yes.
Remember the song correct Octarello? What color is this now?
This is brown. The thing below.
Yeah.
It's brown.
And then what is this one?
This is blue and brown, blue and ochre yellow.
And
This
one.
This.
Yeah.
That one is blue, yellow, blue, brown, white.
It's very confusing. Very, very small.
Yet I can see it.
And one more magical result of Sir and Hanuman. Hats off to Sir for his knowledge and his magical touch. And I'll tell you, this child is still following up with us. He just came few months back and he's preparing to go to US for his further academics. Wonderful, wonderful results. He's applied for his US visa and it's miraculous. That is the magic of homeopathy. That is the magic of predictive homeopathy. There's a magic of Sir and Hanuman. And this is what in predictive we try to emphasize on, that such results are possible. Impossible cases are possible. It's only a methodology which has to be known, a systematic approach of Mayism, understanding the aphorisms to the core and understanding how to pick up that syphilitic symptom in that individual. And once it's all about thought process, it's about process. If you focus on the processes led by Sir and Hanuman and go in that systematic, constructed way, I'm sure we all would get such wonderful results. One more small case I will try to show you and then we will stop here. I don't want to take your time. I know it's quite late. Everybody is up and must be hungry, not eating their food. But just one more small case and a wonderful miracle and a thought process which I would like to share with you. This was again a case of a young child, small child, 5 years old, a diagnosed case of spinal muscular atrophy or dystrophy, right? And then the whole history I will just run through in short and we'll come to the analysis part. So it was a premature child, attending doctor suspected something wrong, as the newborn child had his right hand down by his side instead of both hands in the above head position. So he suspected, he was very intelligent, he suspected something is wrong. There was a swelling on his right elbow. So somewhere, something, again, as I said, that body is trying to throw up symptoms, body is trying to throw certain markers. These are markers, these are pointers that something is not well within. As Hazaman said, this is only an instrument, but the inward internal dynamics of the vital force is deranged somewhere, and we need to hunt for that. On lifting his legs, there was some crackling sound in the spine, and on the 8th day after birth, suffered from breathing difficulty and was admitted to the hospital, given oxygen for 3 days. So as you know that it's a genetic disorder, and this is where Sir was taking homeopathy. Sir has taken homeopathy too. He said that these cases also could be solved with these. That was the dream of Hanuman, that homeopathy should be used in such cases. Ordinary cases, so anyways, would need. So diagnosed as SMA because of SMN gene, which was malfunctioning. So it is a neuromuscular disorder characterized by loss of motor neuron, causing progressive muscular wasting and often leading to early death. So it is caused by genetic defect, which is called SMN1G gene that synthesizes protein in all eukaryote cells. It is necessary for survival of motor neuron. So lower levels of this protein results the death of neurons in anterior horn cells of spine cord and subsequently atrophy of the skeletal muscle. So right at the genetic level also, we need to understand and read the situation, why body has caused disturbance there, why body is or particular gene has been affected. As Hanuman said, it's only an instrument. Then why only skeletal muscles, right? Why spinal cord? Why the motor neuron cells? Everything is mathematics, and we should get an answer for that. So symptoms like hypotonia, weakness of muscles, muscle weakness of limbs. So why hypotonia? Hypotonia is psychosis. Why a particular muscle has become weak? Body is only an instrument. Why the body has compromised a particular part, or weakness of the limbs? Limbs is for day-to-day activity. Limbs is for walking. Limbs is for performance. So what is that which has affected? What is that morbid phenomena? What is that conceptual dynamics in that individual which has affected the limbs? What is the sense of doing only physiotherapy for the limbs, or giving a calcium, or giving only homeopathic medicines only for that particular weakness of the limbs? Are we treating the disease, or are we treating the man in disease? The weakness or hypotonia or atrophy is a resultant of the disease. Disease is still deeper. Disease is at the genetic level. Disease is at the level of protein, where the proteins have not been synthesized correctly or under functioning. So we need to go still deeper and understand. And the doctor observed this in the child was not having sufficient tone in the right arm, so it was not raised. It should have been normally. So condition of the patient when he was brought to Sir, the child used to roll on abdomen. I will show you the video also. He could not sit, he could not rise from the lying position, he could not do as an SMA child is, or not use his arms, legs, but he was very much interested in gaining knowledge and was attracted towards the books and the pen. So point from the history, going quickly, right? So what did Sir find out? As Sir has taught us that as the game, we have to up the game. If in our younger days, how we used to play video games, the video games or the mobile games, or the play PS3, PS4. As the game increases, the level of hardship increases. As the level of hardship increases, the expertise and the that individual who has practiced that game and expertise will be able to solve that and pass through that level easily. Same is the case with our practice. Sir has said that when it's gone to the genetic level, it's to up. We have to up the ante, up the game to such a level that we have to understand why a mutation has happened. And that is why Sir went into the detail of understanding when did the mutation happen, how did the mutation happen, why did the mutation happen. We cannot just take lying down that mutation has happened, because everything has a precursor and everything is a follower. And that is why right from the birth, right from the conception, right from the point where the fertilization actually happened, what was that state of mind? It could be the father's history, it could be the mother's history also. And this is what we try to share in SCPH and SCPH plus what Sir has shared. What has to be probed and how it has to be probed, and it can go to the precise level of what has to be brought from the history. So generally mutation either from the birth or after the birth. So it is either congenital, what they call as acquired later on. But in this case, the child was born with it. So every illness has to have a cause, as I would say. And as a rule, body blindly follows the mind. Nothing can happen without a cause. If I need to pick up this pen from the table, the order has to come from my brain. Creating a mutation inside the body is a big hell process. So without the consent of the mind, aphorism number 189, nothing can go, not even a whitlow can go inside, grow outside without the consent of the whole. So it has to be the consent of the mind inside. And cause of illness is a precursor in the form of thought or a conflict or a process, a thought process in the mind, right? So conflict is a false perception in the mind. It's the Brahm. It's what I believe may not be true. And major diseases which are is been caused is because of certain conflict or false perception going inside deeper and deeper. As the disease goes towards genetic mutation or autoimmune, there has to be a false perception or conflict which is prevailing at the mental level. So disposition is important, not that disposition are not important. Miasms are important. The process of disease expression is important, but what is important is that we up the game and up the ladder. We need to climb up and understand that it is the perception of mind which is causing this, and we have to hunt the perception behind. So the child did not have any working independence. The mind before the birth in the embryo, the child cannot think. The child is following the mother, right? All the nutrition is going from the mother. Then that means the mother's thought process or false perception can influence the child. It's the thought process which influences. As a normal individual, I see certain people laughing at me all the time, and then at a point comes when my processes gets altered, my perception gets altered, and I feel that, oh, everybody is laughing on me, oh, everybody is talking about me. So that is because I get sensitized and my purview about things change and my thought process clear. That can create a particular physiology or that can create a particular physiopathology. Same is the process during the birth. Those autoimmune and genetic mutational cases what we are seeing, and this is whole and soul finding of Sir and his research work, which I could say is purely on, especially on the neurodevelopmental disorder genetic cases, is purely on finding that thought process. Why did the child develop this? He was not interested in what is wrong. What is wrong is one aspect and how it has to be corrected, but why it is wrong, every time he used to question why it is wrong, why it is wrong, why it is wrong. And that why has to be understood. And then he used to always say that, Ambrish, you should understand what has to be corrected in the disease, what has to be treated in the disease, as Animal has mentioned. And when we understand what has to be treated, and then you get automatically understand why this problem has occurred. So some false perception in the child. Somewhere in the pregnancy, mother had been in such a stress that gives instruction to the child. So it's a process. As I said, it's the purview changes. It's not one-way street that suddenly it changes. It's a process which goes, and that process continues for a moment. It can impact the sorry child, and because all it needs is soil, season. So soil, if a mutation has occurred, means the soil is the mother, the seed is the child, and the weather is the situation around. If this goes wrong, then a particular disease gets imbibed, and a particular soil gets imbibed for a disease to get manifested when the child is out of the womb. So wherever it is in pregnancy, the mother has faced some stress. Stress is a general word. Every woman could go through a stress. But what kind of stress happened that it affected the child so deep? So it could be general anxiety. That's okay. It does not create, but anxiety can create if it is prevailing, the anguish is prevailing, converts into fear and fright. Then it can happen certain the predisposed factor which could create. So anxiety and fear could create a child or manufacture a child if the child also received the same inputs, a fearful child or a child which get affected by respiratory complaints. A mother who's been humiliated, a mother who's been insulted, mother who's been not, a libertinist mother for that matter, starts getting affected by this statement or this situation. And a child which is created, a child which is born, has a particular part, disposed part, which could be the connective tissue. It could be the connective tissue. So what was that? This is so something. What do you say? At the genetic level, no synthesis of proteins, and that affects the muscle, and muscle goes into atrophy. Means the body does not wants to survive. Muscular wasting. Yes, muscular wasting. That's right. The body does not wants to survive, and that is what Sir was trying to understand, that why body does not wants to survive. So if the body does not wants to survive, body has given up, body is trying to give up its muscle, the muscle loss, because it could be physiological, it could be physiopathological, it could be genetic. Just weakness of muscles because of calcium level, electrolyte level, etc. At the physiology, it's purely physiological. Less of elasticity, it could be psychotic, but there is atrophy, there's a destruction which is happening because of the protein not being manifested correctly. So which means that the mother has felt somewhere that it's not worth living. It's not worth living, and one should die very easily. As rightly said Dr. Suvarna, it was muscular wasting what Sir was looking at, and it was Sir was considering the rubric death desire. Death desire in this case. So we need to trace the cause of the mother during pregnancy. Very, very important. And each and every part, when it gets developed, and that is why Sir said that if it's the absent of any part, and or genetic mutation, then the first 3 months becomes very important, because that is the time when the anatomy of the child is put in place. But if it's the growth, if it's the process of building, if it's the process of nutrition, then the fetogenesis has to be there. So many diseases fall after post 3 to 6 months, and many diseases which are genetic mutation, deep-seated, would fall in the first 3 months. And that is why we need to understand the whole 9 months of the pregnancy. And I would proudly say that we as a homeopath are considering this history of fetogenesis and embryogenesis. I doubt even any gynecologists are doing it. They are only looking at the fetogenesis part, but not the embryogenesis part. That is where we score probably higher to them. So where we want to trace mother's history, mother's pregnancy history, and this is what aphorism 12 we follow to the core. Sir followed to the core that it is the morbidly affected vital energy alone that produces the disease. It is morbidly affecting vital force which so morbidly affects it. So internal dynamics, we say when somebody is or somebody does not feel well, initially we say, oh, I'm not feeling well. There are no pathological symptoms, there are no symptoms coming, but I don't feel normal. So morbidly affected vital energy on that produces the disease. So that's the morbid phenomena. What was that morbid phenomena? Why did she feel not living? Why did she give up? Why did she resign to the faith? What made her helpless? Which is perceptible to our senses or the senses of the patient, right? Perceptible. So somebody telling me, somebody criticizing me, somebody humiliating me, somebody, what do you say, committing me or propelling me towards a particular step, which is perceptible to my senses. It could be through hearing, through sight. At the same time, all the internal change, where that is to say, the whole morbid phenomena, the whole internal change could be physiological, internal change could be pathological, internal change could be at the genetic level, because this is the process which is going at the genetic level. The whole arrangement of internal dynamics, the whole morbid derangement, how beautifully is mentioned of the internal dynamics. In a word, they reveal the disease. So that's the internal change which has happened because of this morbid phenomena and giving rise to this kind of muscle loss, a muscle weakness, or atrophy, a loss of protein and the functioning of protein, etc. Right? We are altered by individual senses, alter perception, as I said. So first, what I hear, what I see through senses bring about certain individual change in my internal dynamics. I don't feel good, that feel good, or internal kind of vital energy which gets disturbed, and this is continuously altered by my senses and causes an altered perception in me, which traumatizes the body, because trauma is what it could be mental as well as physical. We just attribute to trauma, oh, somebody insulted him, he felt bad. Trauma is much deeper. Primary to that is the alteration of senses or alteration of the internal dynamics which start. So which could be physiological, pathological, and causing a certain change in the dynamics of that individual. So my mother-in-law torturing me, my husband torturing me, my father-in-law torturing me, my friend, sorry, my friends torturing me, and then I feel, oh, I don't feel like living. It's no fun living, or they do not love me. The place is not good for me to live, and I get traumatized again and again, and then influences the internal dynamics. So it's a feedback mechanism again. So it's the mind to body and body to mind. So once the internal dynamics has been preconceived by our senses, brought about by the altered perception, then there are certain change in the biochemistry which is brought about by the internal dynamics and sent a feedback mechanism to alter the senses. It could be through sora, it could be through structural change, or it could be through destruction of tissues. I hope you understand this aphorism. I hope I am able to reach you and appeal to you what I'm trying to say. That in every disease, this can be followed. This is the core. What we predict to homeopath are using it. That every disease has a meaning, and it's not only genetic mutation but malignancy, autoimmune disorders, etc. They have to be understood in the right sense, what an individual is perceiving and how the body is defending. Right? Thank you very much. So history from the mother, 6 months of pregnancy, right? mother was scolded and humiliated by her. This was the morbid phenomena. This was the morbid phenomenon, humiliated by the husband. And when he saw her talking to a man, he called her characterless and cheap. See, the individual morbid phenomena and appealing to her sense would be differ. It's not just humiliation or the sense of humiliation of insult. It is because he called her a characterless and cheap without really understanding her. Why was she talking to that man? He restricted her movements. See, restricted her movements. And so very interestingly, how Sir has always said that when somebody is restricted, some movements are restricted inside, it's the skeletal muscle which gets affected. Skeletal muscle function, if you go to the basic functions of skeletal muscle, is the movement. So those people who get affected by skeletal or affection, inflammation of skeletal muscle, or affection of the skeletal muscles, you can probe in this manner. It's vice versa, right? So he restricted her. It did not allow her to move. And when you restrict somebody, it's the movement of the leg which you affect. It's the movement of the leg which gets affected. So as I said earlier, that this was the latest research very went from the affection of the symptoms to the disease and to the mental disposition. So restricted her movements. She was not allowed to leave and go outside the house. So she was her movement, her freedom affected. And when her movement and freedom is affected, so morbid phenomena which was perceptible by her senses, which brought about change in internal dynamics, and that internal dynamics create an altered perception that tell my child it's useless to move, there's no need to live in this world. And how do I do it? Because it was a syphilitic child which was coming in this world, and she could send this information. The switch of syphilis was triggered. The process of syphilis was triggered, whereby the gene SM and one gene was underfunctioned to produce lesser protein, and then create a particular pathology, create a particular miasm, and create a particular disease inside the child. Is it clear? So it's a wonderful example. Yeah, thank you, Dr. Sneha. Yes, it's a wonderful case to understand that how diseases are produced, and this is what we at Predictive Homeopathy, we want all of us to focus on. Don't just accept that disease just happens. Disease happens for a reason. There is a cause. There has to be the thought process, and through the expression we can understand. Yes, thank you, Dr. Suresh. Thank you. So it's very thought provoking, Dr. Gupta, and it's fun. It's fun once we understand what Sir was doing and how he was contemplating and analyzing Hahnemann. It's just wonderful. It's a great case to understand how he understood the human body and the mathematics behind the human body, and how disease actually originates. So this angered her. She cuts herself off everybody, and she was frustrated that she thought it was to die and not use no use legs and hands. If you are not allowed to use them, death is a better than life. See how the thought process provokes. So certain individuals, if it goes into resignation, it can only go into relaxation of muscles, but not death of the muscles. It not only resigned to the fate. Resigned to the fate is going into helplessness, but she went still above that it's no use for me to live, and also my child who is coming in this world to live. So that is a better option. Material and very important. Aphorism number 10. You can write it down and read it. The material organism without the vital force is capable of no sensation. As I said earlier, it has to have the immaterial being has to have the material organism, and either in health or disease. So whether it is disease or whether it is health, it has to have material. It's only the material instrument. And whenever the disease gets expressed, it's due to the morbid agent or morbific agent or the morbid phenomena. So when a person falls ill, it's only the ritual self-acting vital force everywhere present in the organism. That's primarily arranged by the dynamic influence upon it of it, a morbific agent inimical to life. That was inimical to life for her. So that force of dynamic influence may be inimical to me or may not be inimical to me. Certain people will say, "Oh, so what if he said, I care." Certain people will say, "I care a hang about it," and I pass out the same statement. If she's a Mercury, she's a rebel. But that was an inimical morbific agent for her and to her life, which created an impact on that dynamic influence. And it's only the vital force arranged to such an abnormal state that can furnish the organism its disagreeable sensation and incline to it irregular process. So then that irregular process or less elastin or less of protein and going into destruction or atrophy or dystrophy, and this is what we call a disease. So it's only yes, I'll show you the video clip. Dr. Aman, I will show you the video, how he recovered, or how was he. So it's only what we call as disease. So, as a homeopath, it's we need to understand that the bigger the diagnosis, the easier it is for us to treat, because we want to understand the process behind. We have to understand the mechanism behind. We have to understand the false perception, the conflict behind. So, sir, two rubrics: death, desire, and emaciation. So one is the thought process, and one is effect. So when it goes towards atrophy, it's destruction of muscles. So emaciation, general, so that he does not miss. And you see, so he was diligent, censorious, critical, fastidious, warm food desire. So the remedy was arsenic. The remedy was arsenic 200 single dose. Genetic mutation case, single dose. And I'll show you the video of that patient. This was the first one when he was unable to get up. See that he was unable to, he was just rolling on the floor. Absolutely no movement. See that?
Start.
He's unable to get up. And then I just go quickly. Then and then was brought to the clinic where he was sitting, but he had to do with support. He had to be carried. And then last, you will see, of course, we have many videos. We can go step by step, but I'll show you the last one, which sir had, where he's cycling. boy who was able to get up without one single dose.
Start.
And he is able to cycle his way and play around so wonderfully.
Nice.
Is it not a wonderful result? Again, one more miracle of Sir and Hanuman. The child who was unable to even get up, this child was sitting and kicking, a wonderful result. Such is the mathematics of homeopathy, such is miracle of homeopathy, and such is the divine touch of Sir and Hanuman. Just before I end, give me, wonderful result. Thank you very much. Miraculous results. Absolutely miraculous results. So, for example, number 120, let me say, yeah, 126. So the person who is proving the medicine must be immediate, trustworthy, and conscientious. I'm just trying to come to an end of this session, just trying to provoke a thought process. My father used to always say that, Ambrish, if anybody who wants to practice homeopathy, this is a vidya. This vidya will only come if, yeah, it took few years, 2 to 3 years, or more than that. But then you're treating genetic mutation, which has no answer. Time is not a problem. If you start seeing changes, I think you're on the right track. So if we want to obtain such results, if you want to practice right homeopathy, individual has to be a good human, and it has to be trustworthy and conscientious human. And then, as Hanuman has also said in aphorism number 290, that here belongs also the so-called message of a vigorous, good-natured person giving to a chronic invalid who, though cured, still suffer from loss of rest, weakness, etc. So a person has to be good natured, a person has to be trustworthy, conscientious, and then the homeopathic physician is but nothing but is basically safeguarding an individual. So the acutely observing physician, by the means of morbid signs and symptoms, an arrangement in the perfect conformity. What I was trying to tell you in aphorism is nothing but how Sir was taking its own understanding, Hanuman, and getting it closer and making it a perfect conformity with the infinite goodness of the all, the wise preserver of human life, as very nicely mentioned. And as Hanuman was a wise preserver of human life, I can proudly say my father was a wise preserver of human life. And yes, we can go visit our website, predictivehomeopathy.com. We have our app in Android as well as Apple. We have our books. You can get in touch with Dr. SHOYSON, Dr. Lazar. You have a team there. We can help you, or you can get in touch with Dr. Mr. Amit Day, who is our manager for academics. Information is huge. So this is just a tip of the top of the iceberg. We are just trying to share with you. It's, again, I said, it's mine. It's just knowledge of Sir and Hanuman. I'm just a commentator. I'm trying to share with you what was their knowledge. And aphorism number 53, which says that we make homeopathy difficult. We do not understand the legends and the Hanuman. So homeopathy is nothing but the pure homeopathic healing. This is just pure and simple homeopathic healing is an art. An only correct method, the only possible to human art. Trust me, it's only possible to human art. And the straightest way to cure, certain as there is one straight line between the 2 points. So it is yes or no. There is no element of gray area. So I thank you very much for your patient hearing, and I'm very sorry to keep you awake late. With my little knowledge, I tried my best to infuse that and motivate that thought process of predictive of Sir and Hanuman in you, probably which would be helpful for you in your clinic and your practice. Thank you, IHK platform and all the dignitaries for inviting me and having me on this wonderful day of my father's birthday, and just offering him a small tribute by sharing his wonderful cases. Thank you once again. Thanks a lot, and
Thank you,
have
sir.
a good night. Thank you.
Okay, thank you, sir. Thank you, sir, for the wonderful session and spending so much of time with us. It was really a great privilege and a pleasure for us all to be with you on this special day and this special occasion. So now I think I can call on to Dr. SHOYSON to just give a conclusion, comments on the whole thing. Dr. SHOYSON, please.
Thank you, Dr. Minisham. Now we have come to the conclusion of the wonderful session by Dr. AMBRISH VIJAYAKAR. So I really think it was a mind-boggling session. Such wonderful cases were shown to us, and we all are happy to listen to this great session. So our request to Dr. AMBRISH is that please come to Kerala very often. Like as you all know, Dr.PRAFULL VIJAYAKAR sir was coming to Kerala more than he was going to any other states. He was very fond of Kerala. So, so that is the request from our side, that please do visit Kerala and enlighten us more with your wonderful knowledge. And at this time of the day, it's already 11:15. So I'm a bit confused whether I should say thank you or sorry, because I know you were very busy today. The whole day you have a birthday celebration of Sir in Mumbai. And again, after that, you have spent almost 3 hours for the people of Kerala. So, I have no words to thank you for that. I thank you from the bottom of my heart, and also for all the doctors who have attended this session. So before I thank you, I again remind you about our the next scientific seminar of IHK, which is going to happen at Malappuram on the 28th of August. So please do register yourself at the earliest, and let's have a wonderful session in the next scientific session as well. Okay, so with these words, I conclude my words, and thank you once again to all of you. Good night.
Thank you, Dr. Soishan, and thank you, everyone. Have a very good night. Yes, we'll have SH in Bangalore very soon. Thank you all for wonderful messages. Thank you, and have a really good sleep. Thank you. Bye bye.
Thank you.